The egg is an extremely complex structure. So the genetics is only one, I would say, of hundreds of factors within an egg and an embryo that actually results in a final wanted pregnancy. My name is Schembri Deguara. I'm the lead clinician at HOPE. PGT-A is basically pre-implantation genetic testing. There's only one step in a complex step of selecting embryos, but even if it is not used, a normal embryo will still give you a baby. The protocols we do are carefully monitored. We do a wide range of tests at molecular level before we even start. So we try and achieve a good amount of eggs which are of genetically mature content, and we do so without risking the patient. We want less eggs but healthier eggs than more eggs which can be unhealthy. The laboratories are extremely advanced, so we use time-lapse technology, which is a video of the embryo throughout its development from point of fertilization, and our experienced embryologists are able to look at the features of the embryos throughout their development. Even in good hands, the fact that you are biopsying an embryo, i.e. taking part of the embryo, part of the outer part of the embryo out, can damage the embryo. So using PGT-A as a routine screening tool for everyone has been shown throughout most of the, I would say, the biggest societies in reproductive medicine to be the detrimental effect to embryos and to parents, obviously, if done without specific clinical indications. Even though we do not offer it here, it does not mean the success rates are any less or any worse. We've actually shown to have higher success rates than other centers in Europe, and they all have shown that PGT-A as a routine standalone tool does not increase your chance of taking home a baby. The lower the amount of eggs you have, the less choice you have when it comes to egg selections. And that is one of the advantages of us being able to look at the eggs at the genetic level, because if you collect eggs and you see that most of the eggs that you've collected are abnormal genetically, we would advise the woman to recollect eggs in order to maximize her chance of having a normal embryo development. It is important to note that with PGT-A there are risks. You are taking part of the embryo out, so actually the outer part of the embryo, which is biopsied, can cause damage or even death of an embryo, even in good hands. Knowing what you're dealing with in advance of fertilization enables us to guide the patients as to the statistical chance of having good embryos even before we fertilize them. It is very important that you do not rely on media hype when it comes to selecting your center of choice. Do your homework. They can go home, go back to work, go back to their families if you wish, and have a support system around them, which if you go abroad is basically non-existent.